So welcome, my name is Evan. I'm the office manager here. I'm here with Dr. Stram. And in honor of Lyme Awareness Month, I have a few questions that we're gonna just go through and hopefully bring a little bit more awareness to what we do here at the practice. So Dr. Stram, for someone new to this topic, what exactly is Lyme disease and why is it often misunderstood?
Well, thank you, Evan. So first, Lyme disease is a tick-borne illness. It's a vector-borne illness. It is a microbe. It tends to be a bacterial parasite. So Lyme disease is that, but the issue is that Lyme disease is actually more than that because it is a tick-borne illness which can have other infections within the tick that can actually cause you disease, and they range from other bacteria to other parasites to viruses.
What are some early warning signs of Lyme or tick-borne illness that people commonly overlook?
Sure. So first off, the tick is a really nasty little bugger. It is typically the most common form of the tick to bite is the nymph. And the nymph is actually the size of a poppy seed or the head of a ballpoint pen. It has a little anesthetic in the front of its saliva, so it actually numbs the area up so you don't feel the bite. It's so small you don't see it. But if you do happen to see it, you may get a little reaction to the bite. It may be a little red. It may be something that becomes what's called a bullseye rash. That is not as common as what is usually thought. And in fact, most of the time people don't develop that rash, or it is misunderstood for some other type of rash. So the most common symptoms that you will have are unfortunately no symptoms. Because the bite actually, what it does is it transmits this Lyme bacteria, and the Lyme bacteria is very slow growing. So the symptoms can occur insidiously or take a long time to occur. But if you do get an initial symptom, sometimes that's associated with another infection that is associated with the tick, which is anaplasmosis or Ehrlichia, and those symptoms can be acute. Those can give you high fevers, sort of feeling of really an illness, a really severe illness, cognitive difficulties. That can occur within days or weeks after you get the bite. For some people, you can get flu-like symptoms, sort of, achiness, joint pain, myalgias, which are muscle pain. But again, the most common is you don't know you have it.
Wow. So why do some patients continue to have symptoms even after standard treatment, say from their PCP?
Sure. So, the issue with the treatment is that Lyme is often treated as a bacterial infection that is rapidly growing. And if it's rapidly growing, oftentimes you can treat an infection that's rapidly growing with a 5-day, week course, 10-day course, or a few week course of antibiotics. But with Lyme disease, the bacteria is very slow growing. So it tends to actually double in population maybe every 2-3 days, but it may even take weeks to double. The only way that antibiotics actually work is with reproducing bacteria. They don't actually work against already adult form bacteria. So unlike those other infections which you may be familiar with, like a strep throat or urinary tract infections, those infections you tend to feel better immediately almost after you've given the antibiotics. Whereas with Lyme disease, it can take weeks until you feel better. But if you don't get the life cycles and you're treated only for a short duration, then you can continue to have symptoms. The other problem is we talked about other infections that could be in the tick bite.
Right.
So if you have those other infections and you're only treated for Lyme, you may have symptoms of those other infections that were never treated.
Right.
So that's where testing and going through symptoms to see if those align with those other infections and treating those other infections are important.
So can tick-borne illnesses affect more than just joints and cause broader systemic issues?
Sure. So Lyme disease is also called the great imitator. And it's called the great imitator because it can imitate a number of different disease patterns. So the most common that people remember and think about is joint pain. And so even there, it can be misdiagnosed or misthought of as arthritis or sort of osteoarthritis. You just have pain in one joint or something like that. Or it can be thought of as rheumatoid arthritis, where again, you typically only have one or two joints and it stays there. The difference between Lyme disease is that typically the joint pain is migratory, meaning it moves around. So that's highly specific for Lyme disease. But because it is a great imitator, it tends to go where there has been an injury or something that has happened to someone, or it just happens to go there. So people can have symptoms as varied as just cognitive problems, so memory loss, that's just weird for a young person or even a middle-aged person that just all of a sudden happens. You can have pelvic pain or abdominal pain because there's a predilection or a lot of nerves that are associated in that area, and the Lyme bacteria likes to go where nerves are. Or you can have heart problems where you have rapid heart rate, slow heart rate, you feel like you're passing out. And those are very dangerous symptoms that you can have with Lyme, and you could maybe not have any other symptoms. The other is that if you have any of these co-infections, or if it doesn't affect your joints, you can have symptoms where you feel just muscle pain and muscle cramping or muscle fatigue. But really the idea is that because it is this great imitator, unfortunately it can affect any number or all of the body systems.
So what is your approach to treating Lyme disease, and how does it differ from conventional methods?
Sure. So the first off is time. We want to get a good history. And in our practice, when someone comes in as a new patient, we spend an hour and a half with them to get a full history. Because honestly, history is still the best way of getting at a diagnosis. Testing is supportive, but history is the most important. So what we do is say, okay, do you have a possibility of this being a possible area of a disease or a disorder that you have? Do you have dogs? Do you frequent the outdoors? Do you garden? Do you have any kind of exposure from your job? Are you a landscaper? Are you a farmer? Do you work for National Grid? Something like that that makes you at higher exposure. If you have a dog or a cat, you do have higher exposure just based on their accessibility to the outdoors. Do you live in a rural area? Do you live in a suburban area? So taking the history is the most important. If you hear someone that has migratory joint pain, you actually assume clinically that that's really unusual for any other disease to give you that's most likely Lyme disease. You have to then make sure that they don't have something else. So you may check rheumatological markers, but what we do here is we do what's called a biological terrain. So we actually do a very broad brush to see if there are any other issues that could be causing the current symptoms that you have. And we believe if you do enough digging for those potential issues, and that may include not only lab testing, but it may include CAT scans or MRIs or imaging or chest x-ray. So we like to look at a lot of different issues that could be involved so that we can come up with a diagnosis. But I believe that the difference between our practice is actually just the time commitment. Because we give you the time to get to know you and to form a relationship.
So how important is nutrition and lifestyle support during Lyme treatment?
So what we found, and that's why we include nutrition in part of our assessment, and it's part of what you do when you come here. You see a nutritionist, you see our dietitian, is that we see that inflammation can be associated with your current diet. And unfortunately, the American diet, which has preservatives, it's made with certain chemicals that change the microbiome, which is your gut flora, potassium bromate, which is used as a preservative in wheat products. You can see, because if you leave your whatever bread you get out for a week or 2 weeks, it looks the same.
It's still good. Yeah.
Still good.
Good.
But if you have bread from Europe or bread that doesn't allow those chemicals in there, the bread becomes moldy. So I like to tell people, if your body doesn't know what this is and it sees it as a chemical, then it's going to digest it in a way that may not be healthy. So it may cause inflammation. So we look at those products, sort of processed dairy products, processed wheat products, and carbohydrates that can really affect, the person's inflammatory system.
Right.
And sugar feeds the bacteria. So anything that converts into that. So we looked at as being very important. And then the other is we recommend, but it's really part of the whole treatment, is that people actually also have a mental health counseling appointment, because a lot of people that come to us, if you've had chronic illnesses, it affects you psychiatrically, and we believe that is also very important for your recovery and for your improvement in going through this treatment. And that's part of the management.
Yeah, they've been living with it their whole life.
Right.
Yeah, absolutely. What role does hyperbaric oxygen therapy play in treatment and recovery for our patients?
Sure. So hyperbaric oxygen, which I've been initiated to as an emergency room physician, I saw that firsthand what its benefits are. But hyperbaric oxygen is a very interesting modality for treatment. So hyperbaric oxygen creates increased oxygen under pressure, which allows the oxygen molecules to become smaller and to be able to diffuse or get into tissues where otherwise the blood could not go. So it acts to improve oxygen delivery to tissues that may be inflamed or blocked because of that inflammation. The only way that tissues actually get better and they actually recover is through oxygenation. So if you remove the oxygenation, the tissues won't grow. So in Lyme disease or tick-borne illness, that hyperbaric oxygen actually acts as an antibiotic, because Lyme disease and some of the other co-infections, they don't like to live under a high oxygen environment. They actually like to live in a low oxygen environment. So it actually acts as an antibiotic and treats it. The other is because of that high pressure and the way that you're pushing the fluids further into the tissue, you actually increase the penetration of the treatment further into those tissues that may be inflamed or have a less of a blood flow. So that's how hyperbaric has really made a significant impact on our practice and our patients. We really have seen it being sort of a game changer, an accelerator for the improvement people get, and that they actually improve better than they did with one treatment alone.
Yeah. What is one misconception about Lyme disease you wish more people understood?
So yeah, major misconception is, one, Lyme is hard to get, it's easy to treat, and easy to diagnose.
Yeah.
All those are false. It's easy to get, we are accessible, we live in an endemic area. It is hard to diagnose because the testing is very outdated. The testing is about 50 years old. It is based on your body's response. So unfortunately, if you got a tick bite and you said, I'd like to get tested, we'd say, well, the test would not be accurate for at least 6 weeks, which means in most infections, you want to know if someone has it, so you get a culture, you do a swab of their throat. You can't do that with Lyme disease because you'll get a false negative. So that is one. So the misconception is, I was bit, I'd like to be tested, can I see if I have it? So we actually recommend that you test the tick, because the tick actually, you can see if it has those infections in it. The other misconception is that it's easy to treat with a single dose of antibiotics. That is really false, because one, that study that was done with single dose never did any follow-up. It just looked at people for a month when they got bit. And like we said, it's a slow-growing bacteria. It may take weeks to months to actually get symptoms. So none of those people were ever followed up. And they were given a single dose of doxycycline, which, as we said, this is a slow-growing bacteria that reproduces very slowly. So the likelihood is you're not going to have any effect on just giving a single dose.
Right.
The other misconception is Lyme disease is just Lyme disease. Well,
Right.
there are all these other co-infections. Also, this is a very tricky bacteria and often needs different approaches with using different antibiotics to get at to try to kill it. And so typically single drug therapy from my experience does not work. And those are really the misconceptions. And the other is that once you were treated, because again, a lot of this is that people were treated, they were given a week, 2 weeks, 3 weeks, and they're told, you know, you're fine. And especially even if they were positive testing, because the testing is antibodies, those antibodies can still remain.
Right.
And you can say that, oh, well, you had antibodies, you're going to have antibodies. So it's a way that people can then use the testing to say you just have post-treatment Lyme disease. My feeling is, and my experience is, it's inadequate treatment. And it's inadequate assessment of the full depth of what this is.
All right. And lastly, if someone suspects they may have Lyme disease, what should they do next?
So, you know, look, we want to educate providers and the public to really demand that they get tested frequently. If you get tested once and it's negative, say, look, I'd like another test. Because again, like we said, you can be tested too early or you can be tested too late.
Right.
So if you've had this bite a year ago and you're having all these symptoms and you're tested, it may be too late for you to actually have a positive test. And my feeling is, again, if you look at the CDC and how it originally was documented based on testing, treatment was not based on the result of the testing. Treatment is based on clinical decision making. So if clinically someone has a high likelihood of exposure and may have tests that show some activity and they've not been treated, treat. Antibiotics with probiotics are very safe. And they're one of the safest medications we have out there, as long as it's done judiciously.
Yeah. Wonderful. Well, thank you so much for your time.
Well, thank you, Evan.
Of course.
It's always great to talk to you.
Of course. And if you'd like to learn more, please check out the details in the comments.